on to the next supplementary lead question, which is from Assembly Member Russell.
Thank you, Chair, and thank you, Martin, for that really clear description of what is happening in our hospitals and to the people working in those hospitals. Now I want to talk about the vaccination of frontline workers, and I do realise the vaccination rollout is in early stages and that we won't know for a few months whether vaccination has any effect on reducing transmission. But yesterday the government released guidance that said phase 2 of vaccination may include targeted vaccination of those at high risk of exposure and or those delivering key public services. Now we just this week have had a tragic report from Transport for London that the transport worker deaths have jumped up to 57, up from 8, up by 8 from a month ago. So it sounds like a good idea to switch to a vaccination programme that's prioritised on exposure rather than vulnerability once the most at-risk groups have been vaccinated. But perhaps, Professor Fenton, can you comment from a public health perspective on whether you'd welcome this kind of targeted vaccination programme targeted towards frontline workers after we've done the most vulnerable?
Thank you. I thank you very much for the question. So I think the government is right, as you've said, to focus on the most vulnerable, because in the short, medium and long term that will help to take the pressure off of admissions into the hospital service. I think the evidence on key workers, occupations which are an increased risk, especially if taken into consideration with age and other factors which can increase the risk of acquiring severe disease, may well be another way of thinking about who gets prioritized. In other words, rather than focusing on one characteristic of a person's job, it may be that it is the combination of risk factors that would help to identify an even better, more sophisticated prioritization strategy. But as you know, decisions on policy are not mine. There are the JCVIs, and I know that this issue is being actively considered. So we would look forward to seeing what the recommendations are. But as you know, myself, Public Health England, and many others have done work on risk factors for severe disease, which should, I hope, help to inform some of those decisions.
Thank you. Now my next question is for John Barradell and is about resilience of the workforce. Yesterday again, TfL said that 3,646 members of staff were absent due to sickness, self-isolation and shielding. That's 10% of the workforce, and it's not unique to TfL. It's being experienced by institutions, councils, police, NHS, fire brigade, and presumably teams responsible for fixing critical infrastructure as well. So, John, does this level of worker sickness and absence pose a risk for London's resilience?
Thank you very much, Assembly Member. I think one of the challenges we've got, as you rightly identified, is the number of people who are self-isolating because they may have come into contact with people who have COVID-19. And one of the challenges we have, as you've articulated, is making sure that the public services that we depend upon, not only transport, but the other ones, have sufficient staff to carry on, particularly those that run 24 hours. And indeed, the Commissioner of the Metropolitan Police yesterday, this morning in the Times, identified clearly her concerns around this as well. One of the responses that exists is to get asymptomatic testing within the workforce, particularly those who may need to self-isolate, and in a pilot sense to see whether there are ways of getting these people back to work quicker without any increase in risk to themselves or indeed their communities, as one way of managing that. And that work is underway at the moment within London, particularly with our emergency services. Kevin, you may want to comment again on some of the efficacy of this, but that, Assembly Member, is one of the routes through the inevitable stress on the system, one, for the pandemic lasting so long in London, and secondly, our dependence on this as a system on public sector workers and public services in London.
Thank you. Kevin, did you want to comment on that briefly? I'm quite short of time.
Yes, very briefly. I think as one of the things we're focused on during the lockdown period is how do we strengthen that comprehensive package for key workers, which goes from asymptomatic and symptomatic testing, support for isolation, and the other things that we need to do with local businesses and organizations to ensure that there's routine testing and screening in place. I think that's going to be a key element of managing risk in this group.
Thank you. I'm just going to briefly go back to John to just ask if it's possible to share any data that you have access to on workforce safety, sort of particularly things like reporting outbreaks in workplaces in London. Is that data that you're able to share? Sorry, you're on mute.
There had to be the first person, didn't there, Assembly Member? There went. I'll certainly take it away and see if the data is releasable. Part of the problem, clearly, is making sure it's not personally identifiable. But subject to that, I will take it away and I'll write back to the Assembly regarding the availability of that.
Thank you very much. And then picking up on what Kevin was just talking about support for people to isolate. A constituent told me she had a head cold before Christmas, got tested for coronavirus and was positive. She reported her contacts to track and trace, and that resulted in the pub where she worked closing, her colleagues losing work, and also her flatmates. She felt really guilty. Now, support for isolation is discretionary. She was on universal credit, it was automatic, but her colleagues and flatmates got no support. So this is for Kevin. Are you seeing any impact on the transmission from people exposed to coronavirus who don't have the financial support to isolate?
So we're very concerned about people who may be exposed and who do not isolate. Isolation is one of the key control strategies, and we know that a significant proportion, it varies by study, but between 30 to 50% who are infected may choose not to isolate for the full period because of concerns on their household economy, getting back to work, or maintaining a job. And so we need to systematically look at all of the areas where we're missing people to identify what sort of support is needed. And this has been part of our asks to our national partners to help to streamline the process, strengthen funding, and ensuring that compliance is built in as well. And this is, again, a bit of the work that we're keen to do during lockdown, so that we emerge from lockdown with a stronger package of support for people who need to isolate.
Thank you. I'm out of time.